Dr. Ulzen, thank you for taking time to join us today during Mental Health Awareness Month. We appreciate it. Let's begin with something we talked about earlier. And instead of starting with something like alcohol and moving to major problems, let's start with the major problem. Everywhere I go, people are talking about the problem of heroin abuse and people dying from heroin. That must be something you deal with daily or weekly.
Yes, it is something that has become a national epidemic, really.
And that's because it's cheaper than it used to be, easier to get than it used to be?
It's become much easier. It costs the people who make these drugs less to make them. And so a very strong narcotic like an opioid like heroin is very cheaply and easily available to people who don't even have a whole lot of money.
I've never been able to get my brain around buying a substance from a criminal and then putting it into me. But that's logical, and people who are addicted to a drug or have used heroin, that's not something they think about. They just want that fix again.
Yeah. I think really, when you think about substance abuse across the board, we're all very different genetically,
Yes.
and we all have a different sense of equilibrium about ourselves. And so some people are more vulnerable to feeling like they need to take something, where other people may not. So I'll give you the example of maybe 4 people just go out and go drinking as buddies.
Yeah.
And then there's one who can never seem to stop, though the other 3 can stop at 1 or 2 bottles and go home because somehow they feel a need to keep taking this.
It would be wonderful if doctors like you could identify those people who are predisposed to having that weakness or that illness.
Yes.
We don't really have that luxury, do we?
No, not for everything, but there are some, especially in the area of alcohol, there are some people who we know have a gene called the OPRM gene, and they are very, very susceptible to not being able to stop once they start. And so we are at various levels of identifying people like this.
Is it fair to call it that it can be heredity in nature as well,
Yes.
that if your father was an alcoholic, you should be cautious because you may have that same kind of gene as you mentioned?
That's right. There's a very large part of it that is genetic vulnerability. And then you have environmental pressures like peer pressure or reactions to life events and things like this, which all sort of work together to create a deadly mix.
Help us understand this too. Those of us that have never done drugs like to look down on people who do.
That's right.
And think why they shouldn't do that, they should never have done that. That's a gross oversimplification in your world, right?
I think there's a real stigma. There's a stigma around mental illness in general, but I think that the stigma around substance abuse is even stronger, where people feel that there is a choice involved. That's really misplaced, because when people who are addicted to substances take substances, it actually alters their brains in ways that it might not alter the brain of somebody who is not predisposed to addiction.
Right. What can we do then to be more caring, more sensitive, more supportive of people who might have a drug problem or even an excessive alcohol problem? Do we just need to educate all of us better to understand that, like cancer, like any other disease, this is a disease?
It is a disease, and I think that this is the kind of thing where our public education efforts should start very early, because the age at which people become introduced to substances is around the adolescent years. So if you really want to do anything about this, you need to be talking to people even before they become adolescents, and then continue with that.
We've probably made the mistake over the years of trying to educate high school and college students about the dangers of drugs when it should have started in the 4th grade, possibly.
4th grade or at latest middle school, I would say.
As soon as they can know about it, we should be educating better.
That's right.
Are we doing enough? And I know the government isn't our answer to everything, but are we spending enough on research and on rehabilitation and prevention? What areas should we do a better job in?
I don't know that we ever, as a society, have spent enough on mental illness or substance abuse, because the disease burden from substance abuse is quite high. That is, people who have it lose so many days of work every year compared to people who may have a pneumonia or something else that we recognize quickly as an illness. And so we're not really spending as much as we should for the kind of burden that it carries.
You know this without me telling you. There are people watching you right now,
Mm-hmm.
online or on television, who love someone who
That's right.
is addicted to
Right.
drugs or alcohol, and they're sitting there going, "Oh, I wish I could get my loved one to go to that
Right.
guy and talk to him and get some
Right.
help." What guidance would you give the one that's not addicted but who cares about someone who
Right.
is? What advice would you give them to try to turn the wheels of getting their loved ones help?
Right. I think that usually people are very much wanting to help those who are afflicted, but then the person who is addicted is sometimes really the stumbling block,
Yeah.
so that they have tension already with the person that they want to help. I think if you break your leg, it's very easy when somebody picks you up and say, "I got to take you to the ED."
No problem. Absolutely.
But with something like this, it becomes more difficult. But in any event, we are available to help people. There are many programs, even in our city.
Yes.
Apart from our own service here, there are other treatment programs like Bradford, other programs around in the city. And I think people should just at least call and speak to somebody on the phone about what possibilities might exist for the person they want to help.
And most doctors, if you have a doctor, they can guide you to the right place to
Absolutely.
go for help. Almost any doctor can
Any
do
doctor
that.
could do that.
Very good. How long have you been at this? How
As
long
a
have-
psychiatrist?
Yeah, as a psychiatrist dealing with substance abuse.
Well, as a psychiatrist, I think I qualified in 1985. I've got to think about this. So I don't know how many years that is now.
And in that time, that's quite a while, but in that time, what has been the most consistent thing in trying to help people? I know everything changes from
Right.
what people use to what. What's
Right.
been the most consistent thing that you found?
I think the most consistent difficulty has been either one is denial that there is a problem, and two, that the person, as we talked about earlier, is not trying hard enough to do something about it.
Very good.
Those are the key sort of obstacles that we have.
Wouldn't it be fun someday to come back and interview you after we've eradicated addiction problems? I'm afraid that may not happen in our lifetime,
Yeah.
but we can do what we can do today.
Yeah, I think we're understanding it also better and better as we go forward.
Dr.
Yeah.
Ulzen, thank you for your time today. I appreciate it, and you've helped us a lot.
Thank you.
Thank you.